Today, during our TED Talk, we will be trying to get across to you the importance of the brain. We will be doing this by teaching you the parts of the brain, their functions, and how they communicate with nerves to help us move. Also, we will be teaching you how drugs and alcohol can affect the brain in a bad way. Lastly, we will explain to you a brain disease that we think is important for you to know so that you can be aware of it. The five main parts of the brain are the forebrain, the cerebral cortex, the limbic system, the midbrain, and the hindbrain. The forebrain consists of the cerebrum, the thalamus, and the hypothalamus. The forebrain's functions include processing and receiving sensory information, thinking, perceiving thoughts, controlling motor skills, and understanding language. Almost all sensory information enters the part of the brain where neurons send the information to overlying cortex. Any information including sight, hearing, touch, and taste go through the thalamus, which then sends the information to parts of our brain to get processed. The thalamus. The thalamus controls sensory and motor functions. The cerebrum. The cerebrum is the largest part of the human brain. It is mainly associated with higher brain functions such as thought and action. The limbic system. The limbic system is the part of our brain which controls majority of our emotion. It is located in the forebrain. The limbic system consists of three parts: the hypothalamus, the amygdala, and the hippocampus. The hypothalamus. This part controls the feelings of thirst, hunger, body temperature, sexual arousal, and the endocrine system. The amygdala. This controls memory processing and puts all of your memories in the right places of the brain to be stored. The hippocampus. This deals with some memory processing, but mainly works with emotions like anger, jealousy, and madness. The cerebral cortex. The cerebral cortex is located in the forebrain. It is an outer layer of neural tissue located around the cerebrum. The cerebral cortex is a gray matter made up of cell bodies. The human cerebral cortex is about 2 to 4 millimeters thick. The cerebral cortex. This part of the brain's role is memory, attention, perception, awareness, thought, language, and consciousness. The midbrain. The midbrain consists of the tectum and the tegmentum. The brain's job is to control sensory information with simple movements. For example, by reading this presentation, you are using your midbrain to keep your eyes coordinated with your head and the information you are taking in. The tectum. This controls hearing and visual and auditory reflexes. The tegmentum. This controls motor functions, regulates awareness and attention, and regulates some autonomic functions. The hindbrain. The hindbrain consists of the cerebellum, pons, and medulla. The hindbrain also includes parts that are important for the level of consciousness and for sleep. Some structures within the pons are linked to the cerebellum, thus are involved in movement and posture. The pons also control facial expressions. The cerebellum. This controls balance and coordination. If you were injured, you would experience difficulty coordinating fine movements, difficulty walking, tremors, dizziness, and slurred speech. The medulla, responsible for maintaining vital body functions, such as breathing and heart rate. Without it, we would not survive. It also controls blood pressure. The medulla is located on the top of the spinal cord. If the medulla would hurt, it is possible that involuntary muscles and movements would not function. In this case, you would be in a life-threatening situation. Pons, involved in motor functions and sensory analysis. Information from the ear first enters the brain in the pons. The pons also control some facial expressions. You may be wondering why we just taught you the parts of our brain. We feel as if everyone becomes familiar with the parts of the brain and how they function, then everyone will be more keen on protecting their brains.
We will now be looking at the brain differences between a regular, an alcoholic, a drug user, and an epileptic. Our brain is very important. We only have one, so it is necessary to keep our brain safe. Drug and alcohol affect the brain like no other. A person who struggles with alcohol is usually depressed, as well as someone who struggles with drug abuse. If you abuse drugs, you will have less control over your brain and you won't be able to do your normal activities, like sports, clubs, and you won't be able to focus in school. The drugs will eventually take over your body and you could die. If you're an alcoholic, your normal brain activity will slow down and become depressed brain activity, shown in the picture, and which will affect your entire life, especially if you're in school. It will affect your ability to play sports, to learn, keep up with schoolwork, and most importantly, alcohol will affect how your body functions, especially your brain. Some people abuse drugs and alcohol to cope with daily stress and tension. People who use drugs and alcohol don't know how the substances can be a danger to them. They say, well, I feel happy and calm right now, so I'll keep doing this. Their brain will try to warn them at first, but eventually it will get used to drugs and alcohol, and they cannot tell what is happening inside their body, but most importantly in their brain. According to Florida Institute of Technology, when drinking or drug use becomes a mean for coping with life's problems, it can turn into an addiction. Unfortunately, alcohol and some drugs have become more socially acceptable and makes it easier for people to experiment at younger ages. This is because a young child is still developing their brain, so more harm would be made if alcohol or drugs were put into a child's system. In addition, alcohol and drugs are readily accessible to many of today's youth, which further increases the likelihood that they will use the substance at some time. So, if you are struggling with an addiction, you should get help. Now, we have some statistics that we hope will change your opinion on drug and alcohol use. Alcohol is the most widely used drug in America. It is the third largest cause of death in the United States, second only to heart disease and cancer. Alcohol and tobacco use are a significant risk factor, and heart disease and cancer accounts for over 1,000 deaths per year in this country alone. It is also the leading cause of death for people between the ages 15 and 24. Over 60% of admissions to emergency rooms are either directly or indirectly due to drug or alcohol usage. Here are some long-term effects of alcohol use. Nutritional deficiencies affecting mental abilities, damage to physical organs including the brain, liver, heart, and stomach, breakdown of bone and muscle tissue, memory loss or impairment, impaired attention and concentration, inability to get along with others, difficulty coping with school or employment demands.
We are aware that there are many brain-threatening situations other than drugs and alcohol. We know this message is aimed towards drugs and alcohol prevention, but we wanted to introduce you to a disease that is in our society and is unexplainable. We want everyone to understand that people with brain diseases aren't weird from a regular person's brain. We know that epilepsy is unexplainable, but we are trying to grasp the concept on how different brains work. This is just one of the many examples. Epilepsy is one of the most threatening brain diseases out there. Epilepsy has an unknown occurrence and can be caused by injury and illness, though sometimes people that are healthy get epilepsy, so there is no real reason for the disease. Because it is a disorder of the central nervous system, effects can be felt throughout the body. Due to unpredictability of seizures, there can be a great emotional toll taken also. When both sides of the brain are involved, it's called a generalized seizure, which may cause loss of consciousness. Absent seizures, or petit mal seizures, are short, usually lasting half a minute or less. A person having an absent seizure may appear to be staring and will have no awareness of what happened. There may be some facial twitching or rapid blinking. In atonic seizures or drop attacks, there's a sudden loss of muscle tone, causing you to fall without warning. In a generalized tonic-clonic seizure or grand mal seizure, the body and limbs contract and extend. This is followed by a tremor, after which the muscles relax. Other symptoms include fatigue, severe headache, and body aches. Sometimes there are speech and vision disturbances. People who have numerous tonic-clonic seizures are at an increased risk of sudden unexplained death at epilepsy. Myoclonic seizures involve sudden jerky muscle movements. This type of seizure usually happens multiple times a day over several days. Status epilepticus describes a seizure that lasts for an extended time, usually from 15 to 30 minutes. It can also mean you're having multiple seizures without coming conscious in between. Status epilepticus increases the risk of permanent damage to the brain. According to the Epilepsy Foundation in Michigan, about 30% of people with epilepsy eventually develop clinical depression.
Epileptic seizures can also make you more prone to falls and injuries. And as shown in this picture, you can see the effects of an epileptic brain and a normal brain. In this brain, you can see how it's kind of wore down. It doesn't have as much control over the red, and you can see the different colorization. So yeah.
After learning all about the brain and damage that can be done, we hope that our audience will take away the importance of the brain and take care of their own. You only have one chance in life, so we hope that you take care and preserve your brain. Many people don't realize how bad drugs and alcohol can and will hurt your brain. We are trying to bring awareness to the fact that drugs and alcohol are a big problem in our society, and we want to make sure that everyone knows what can happen to them when these substances go into their bodies. We appreciate you listening to our talk, and our ambition is that you will take what you learned into consideration and pass on the message of the importance of keeping your brain safe and healthy.